So the question of who can innovate is a great one because I think everybody can innovate. The workforce within healthcare has to be empowered to innovate. And I think there are some policy type things that the Affordable Care Act or the government has now laid out for the workforce, for hospitals, for health systems to actually give that incentive to percolate the ideas that the creativity of the workforce itself generates, to have them actually percolate to the top. And the underserved communities themselves actually provide perhaps the best opportunity for us to innovate. As we know, coordination of care, or in this, up till this point, fragmentation of care has been a real challenge for healthcare. In underserved communities, this is probably the most emphatic or the most realized in some way. So although we have a big challenge in the underserved communities, in some ways that presents the biggest opportunity for us to innovate. Medicaid programs and states, for example, are doing a lot with state innovation models where they actually work within Medicaid type programs for the underserved. CMS, for example, so again, Medicare and Medicaid at the federal level is also doing a lot to fund these kind of state-based innovation models. And there we have the opportunity to actually change the very core parts of healthcare to stimulate innovation, again, in the underserved type of communities. So this can be on the realm of, for example, how we pay for care, and then how providers then will respond to the incentives to actually improve not only the specific processes and operations of how we deliver care within a hospital that, for example, is a safety net hospital, but also then how do we work with the community? How do we build a medical neighborhood? So hospitals actually have to work with the nursing facilities, to work with the homeless shelters, to work with the community centers that encompass or surround that very safety net hospital, and to work in a coordinated fashion. So in some ways, I think the workforce in these communities, as well as the policymakers, the decision makers, and the leadership, all have a key role in thinking about how we innovate, how we deliver care for those patients. Finally, the one last piece I definitely don't want to forget is the patients themselves. We as a health system have far too long thought about how we deliver healthcare from the perspective from the providers and the payers themselves. Luckily, in the Affordable Care Act, and now again in state-based initiatives, as well as in general in the medical community, we have a nice impetus to actually engage patients, to pull patients into this process and ask them, how do we change how we deliver healthcare in a way that makes sense for you? So if we have a patient who has problems with mobility, who needs a wheelchair or a mechanized wheelchair to get around, does it make sense to say we're going to build a patient-centered medical home that's 13 miles away from them? Or maybe we should do something like the VA is doing and create home-based care programs. So there's a lot of creative ways, and I think we're starting to engage not only the workforce and the leadership and the policymakers, we're also now starting to learn that we have to engage patients. And as patients get more and more integral into this process, we're learning more about how to actually meet their needs, to actually transform healthcare as, first and foremost, a service industry to impact not only patient outcomes, but also patient experience.